clear, and the patient doesn't have a high degree of literacy as to what's covered, and so they have something done and find out that it is not covered. Sometimes it's simple. The policy will say that they're not covering cosmetic surgery. Okay, if they covered cosmetic surgery, then everybody's premiums would go up because people might want to get plastic surgery and have it get paid on the dime
that'd be
of
nice,
the insurance. So that's an example.
Yep.
They also can get somewhat sneaky in that they deem some procedures experimental. And it may be that it's experimental to them right now, but it may be mainstream in 6 months. But they haven't had a meeting and met and accepted it in their insurance plan that it's a proper procedure to do on folks. So they don't keep up with medical advances. And that's happened to me as a vitreoretinal surgeon. As a retinal surgeon, we have new things that get released, and when it gets approved by the Food and Drug Administration, immediately that day you can do it on a regular Medicare patient. So if it's approved by the government with the Food and Drug Administration, there's no wait period.
Okay.
But if you do it to somebody who has private insurance or has given up their Medicare to a managed care Medicare, so it's now being run by another company, it's only when they say you can do it, then you can do it. So sometimes there can be a delay of several months, and it is very hard for the doctor to say, okay, I have some new thing, and you're talking to them about it, but then if the patient wants that, they're going to have to pay separate because it's not a covered benefit according to their insurance company.
So part of the reason that Dr. Bourgeois is here is to answer your questions as well, because I know there are a lot of you that probably either have a bill or you're afraid that you're going to go in to get something done and end up with a bill, and you're trying to figure out how to avoid that. And I think that's a huge question to be answered, because some of us try to do our homework and plan for things ahead of time, and then before you know it, somebody in the process is out of your network, and then you end up with X amount of dollars on a bill from the anesthesiologist or from somebody who you weren't expecting. And by the way, questions anytime. We're going to stop what we're talking about and answer those questions in just a minute. But
so that happens because there are different types of insurance products. The one that people remember I'm 59 years old, older than me and around my age, were called indemnity plans. And indemnity plans indemnified the patient that they would basically pay whatever bills that you had for your medical care. They didn't care whether you were in some panel or network. They paid all bills. And a lot of the older patients love that insurance, which you can't get anymore.
Yeah.
Pretty much.
Yeah.
And it was a very easy system. You sent the charges into the insurance company and they paid them. Then came HMOs, or health maintenance organizations, and there's still some very successful ones in the Houston area.
Yeah.
Health maintenance organizations give a panel of doctors and you have to get the care. If it's a non-emergency care, you have to get it from that panel. And it would be like saying you have a credit card that says Exxon or Shell. You can only get the gasoline from an Exxon or Shell.
Right, right.
The nice thing, though, about an HMO is that there's a provision that if emergency care is given, the patient is held harmless. I'm not a lawyer. I just wanted to explain that a little bit.
Okay.
That the HMO then goes to the non-contracted providers that aren't part of the HMO because you did emergency care, and they will negotiate with the practice and pay the practice. The patient doesn't have to pay for that if it's a true emergency in HMO.
Okay.
So, and then there's PPO, or preferred provider organizations. Preferred provider organizations are
which is what I have.
One of the biggest insurance products out there.
Yeah.
You get a wide variety of people to go to. It is easier for the doctors to join PPOs. They want a lot of doctors. They want a big network for a PPO.
Yeah.
And there is a benefit to going out of network, but there is a greater benefit, meaning a different sliding scale in what you pay if it is in network. So, for example, they might say if you go out of network, we'll pay 70%, but if you stay in network, we'll pay 80 or 85. So they're trying to steer people to a in-network provider.
Well, and I think most people do their best to stay within the network. I mean, it makes financial sense to do that.
But they will pay for out-of-network because sometimes there's just very few people that do certain services. And that's when it gets tricky. But in their language, they only pay an allowable amount, or what they call usual and customary, which a lot of doctors like to joke, it's not usual and it's not really customary. The state has previously fined insurance companies, and one of them paid a fine of $3.9 million because they were saying that they were not paying enough on the bill, leaving a balance that the patient then has to pay. And the unfairness about it is for the same surgery or the same procedure, different insurances have what they call their proprietary formula and make a decision on how much they'll pay, leaving the patient with the balance. And so they'll say that they'll pay 70% of the service, but it's of the what they call usual and customary or allowable fee. And in a way, it's a way to gyp patient if they set something artificially low. The Texas Medical Association found an example where on bill charges, one insurance company, their rate of payment was 53% of what the bill was. The next company, though, was 94% or 96% of what the bill was. So it is way better insurance to have the one that pays 96% than pay 53%, because then your balance billing amount will be a lot higher if you select the one that is conveniently paying less.
So I'm going to I think some of these, more than anything else, that people are just making comments.
Yes, ma'am.
And I think they're probably comments out of sheer frustration, which, we understand that. I think so many of us have been in that situation. Somebody says, I have a $2,900 bill from an ER visit 3 weeks ago. Ridiculous to say I have insurance. Sorry.
Well, so I can't directly comment on that because I don't know what insurance she has.
Yeah. This is Brandy Nicole. Hi, Brandy. Thank you for your comment.
One of the things is that was shocking to me, the deductible, which means what the patient has to pay, just like auto deductible, you get in a car wreck, you have to pay the first $500 to get your car repaired, okay? The deductible for the Affordable Care Act, the Obamacare Insurance Silver Plan, last year, the average deductible was over $3,000. And so you could go to the ER, have everything in network, everything, and you still have to pay the first $3,100. So yes, you have insurance, but that's the deductible that the patient picked. They picked, if that hurts them, then they picked too high of a deductible.
Okay.
Yeah. So speaking of deductibles, it used to be quite easy. In 2006, the average deductible was $303. Okay, so $300, less than most people carry on the deductible on their car insurance.
Right.
And so I was fortunate to practice in that. It made it a lot easier, and we didn't have to be as careful in the very beginning in January and February and March, because by the time people went to a few doctors, they'd met their deductible already.
Yeah.
Well, last year I have figures on, it was almost $1,100. The deductible has risen, and I believe that was 2015 data for PPO plans in Texas. And so the insurance people are very frustrated, and we feel their pain, that they are paying a lot for the insurance, but the deductible has dramatically risen.
Right.
So that they're paying, if they're luck out and they're doing well, they're still paying out, and the insurance doesn't have to pay anything.
Right.
So if they're doing routine testing and don't fall and break their leg or something.
Yeah. Oh, it's incredibly frustrating.
Yes.
It's like I just feel like I'm paying and I'm paying and I'm paying. And in my case, I'm really healthy, but I feel like I'm constantly paying More than, I don't know. I just feel like it's
well, I've been without insurance for about a week and a half in my life, between my medical school and internship.
Did you get sick within that time? Of course you did.
That's why I'm telling the story. I went through the windshield on I-10, went through the face first, and broke, cut myself up good, broke my collarbone, broke my rib. And so, there is a point to having catastrophic insurance. So even though people may feel they have to have an insurance with a very high deductible, if you ever do get in a serious car wreck or something, it's going to be very helpful to have that.
So a lot of people on here are commenting. Jolene, who is constantly commenting, and I love her because she's always got something to say about every topic, and I really appreciate that. She says there's some value in going to urgent care versus a standalone ER or a hospital ER. Do you agree with that?
There can be, and there's also certain family practice doctors that have weekend and night hours. So I'll even go further. Sometimes it may be better to see if there is a family medicine clinic open.
Yeah.
But the urgent care centers do have a role. They try to make it very convenient. The patient has to check to see if they, are in network, if they want to use in-network benefits.
So I want to just expand on that because, I know you can call and check. Now, forget if it's an emergency. I mean, who's going to stop and call and check in an emergency situation? But if you've got something planned a procedure that you're having done, you can call, right?
Yes.
And find out if everyone who's going to have any access to you is within your network. Is that right?
You should be able to.
What does that mean? Does that mean there are going to be some hospitals that won't be able to tell you?
So the problem is what we found in our office and what we found calling ourselves for people trying to help patients is that they sometimes the insurance company gives erroneous information. The example that a patient of mine was in the Houston Chronicle about a surgery that I did to save he had a detached retina. The story was I saw him, told him what he needed. He needed an urgent surgery. We called the insurance company because he had just changed his insurance plan.
Yep.
We called in and they originally told us we weren't in his plan. I offered to assist him. They sent over a fax of all of the 13, 14, 15 ophthalmologists in the plan. Yep. I glanced at them. Unfortunately, only a single one was a vitreoretinal surgeon that he needs. So there was one. He drove across town to go see this doctor, find out that when he gets there that the man is heading to a plane to go out of town.
Oh, geez.
So
of course.
He had
of
nobody.
Course.
There was nobody in this person's network to do it. Subsequently, we get a phone call that they gave us an authorization number to do the surgery and that they told me that I was in network. So then I do the surgery. They told him and I that we were in network. I do the surgery, turn it in, submit it to the insurance company, and then get denied saying that I'm not in network. And so
the responsibility there, does that end up falling back on the patient?
So yes, it goes to the patient, even though the patient so I wrote a letter asking them, there's a way to appeal a decision.
Yeah.
I wrote a letter of appeal saying you should cover it because you had nobody to do it, number one. And number two, you gave me an authorization number, said that it would be a covered service for the patient.
So in the end, was it covered?
No, it wasn't covered. They denied it again. They denied my appeal letter. And so we are trying to we can sometimes be our patients' best advocates because we understand some of the terminology.
Yeah.
But it's quite frustrating to us because we don't like our patients being taken advantage of.
Yeah.
And this person is a lawyer, and he is, I believe, in the process of suing the insurance company.
So if I am going in to get something done, Never mind the emergency, because I don't know in an emergency scenario what you can do other than be prepared and do the research yourself ahead of time in the event that something happens.
So,
but what if I'm in a car wreck in San
So
Antonio?
so let me back up.
All
Yes.
right.
So when you go to buy insurance plans, there should be an attempt to the cities that you normally go to try to find out how much of emergency room doctors, radiologists, anesthesiologists, etc., are covered. And the TMA, Texas Medical Association, has a white paper, they call it, The Truth About Surprise Bills. It's about 13 pages long. And there's some great examples where they've looked at the Austin market, because the Texas Medical Association is in Austin.
Yep.
And they find that some of the insurance companies only have around half of the emergency room doctors in their in-network facility. They're only contracting with half. So the patient is just as likely as not, if they get in a car wreck and they're brought to the hospital, they're not going to be covered half the time. And the patients don't realize that. Furthermore,
I have a 50-50 shot.
50-50 shot. I heard a friend in the Rio Grande Valley said it's worse down there. He said he called around and looked at the major 4 or 5 big insurance companies, and it was a 90% chance that they do not have emergency room physicians covered in the Rio Grande Valley. So there's a 9 out of 10 chance that they're going to get a bill because the insurance company isn't contracting with the emergency room doctors.
So, all right, tell us really quick. He's got a bunch of papers here in his lap, and all of this stuff, these were his cheat sheets. And I said, people are going to see your cheat sheets in this Facebook thing. But tell people where you got that information,
Yes.
because they can go and look this up as well.
So you could use your search engine and just type in Texas Medical Association, and it'll come up to the actual website. It's www.texmed, that's texmed.org.
texmed.texmed.org.
Yes, and they have a subsection on surprise
so it's easy
billing.
to find when you get there?
It says surprise or balance billing.
And remember, surprise in this particular situation is not a good thing.
No one likes to get a bill that they thought that they would have covered by the insurance company. We definitely get it. And it's easier on most of the physicians. It's much easier if the insurance company would contract with you. And the frustrating thing is that people call our offices all the time and say, do you take insurance XYZ?
Yeah.
And we have to explain to them that, yes, we do, but they don't understand that the big names at the United, whatever, have 15 or 20 different plans. They may let me in 10 of the 15. And so we can answer the patient's question, yes, I take insurance so-and-so, but I don't know if your plan I take.
Okay, well, and so maybe that's something, all right, for me, as I get insurance through work.
Yes.
This is what I did, and I believe so far it's worked for me because I haven't received any extra bills out of this eye procedure that I had done in December.
Yes, ma'am.
And funny because he's an ophthalmologist, just not mine. I called my insurance company and I said, tell me exactly what my plan is. Every letter, everything I need to know so I know exactly what my plan is. Then I called the hospital where I knew my procedure was going to be done.
Correct. And
I said, I have blah, 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 and I rattled off the whole thing. And I said, is everyone who's going to be involved in my procedure covered with my insurance? And in this case, they said, yes.
Yes.
And I was lucky, I think.
You were lucky, yeah. What people need to understand is there's usually a facility fee, which is fairly easy to look up if the hospital, or surgery center is in the network. Okay, that's usually pretty easy.
Yeah.
So there's the facility, and then there's the surgeon. And then for most surgeries, there's an anesthesiologist.
Right.
Okay. For some surgeries, there's a radiologist if they have to, take x-rays or imaging or some kind of. And then it depends on what type of surgery. Sometimes there's a pathology fee too.
Yeah.
Okay. A lot of people don't think about all the different components. The surgeon's office or office staff usually can aid in saying, okay, these things that you had operated on are so small, we don't send them to pathology. So you don't have to worry about calling the pathologist.
Okay.
Okay?
Yep. But these are questions that you need to ask
Correct.
beforehand, so you know exactly who you need to check on.
And there's some for elective surgery. I know we do this in our office. We have a number of basically the central billing for the anesthesiologist, and the patient can call in directly with their insurance card and find out if it's covered. And I've had a single patient this past year where the hospital was in network, I was in network, but when he called, the anesthesiologists were not, and so he elected not to get surgery with me. If he wanted to try to find a matching of everybody, and so he elected to try, he said, could I give him a list of other retina surgeons? And so he went and got it done by somebody else.
Well, that's the world we're living in
Yes.
now, where you have to do that. So, okay, let's fast forward to, because there are a lot of people on here who are talking about they got a big bill that they weren't expecting. And I've heard before that, it's worth your while to call. It is worth your while to get in touch with them and see if you can lower your bill. Can we talk about that?
Yes.
Does that work? And what do you say
yes.
to get it to work?
It depends on, so I'm not only a surgeon that operates on people and get money paid by insurance companies, but I'm a father of 3. I've had to get surgeries before, and so yes, I had to deal with this. While I was chairing this task force on balanced billing, I got a balanced bill from my middle son that twisted his ankle, and we went to the emergency room, and someone wasn't covered. And so they usually have a 1-800 number to call up, and they will you can usually negotiate that if you pay it promptly, then they will offer a certain discount. But that they're not forced to do that, but most of them will. So,
did you kill them with kindness? I mean, how did you go about it? Did you make the call?
I actually called myself, and so there were two things. I questioned the level of care that was billed, and then I wanted them to review the records.
Yeah.
And so they said, well, that would take about a month and a half or 2 months. And so then they subsequently called me back and said, well, that'll take time for us to do it and will take effort and work. If you would like to resolve it now and pay a certain percentage of it, we'll accept that as full payment. And that's what I ended up doing.
Can I ask just the percentage? What percentage did you pay?
I'm not trying to smokescreen. I can't remember. I think it was something like I paid 2/3 of the bill, something like that.
Okay. Because they always want their payment right away. Even when you do get that surprise bill, pay upon receipt.
Right.
Who's got that kind of money?
Well, that can be a problem.
Yeah.
And
so Melissa Boggs, who's been listening, because she's kind of lumped a few things together after listening to what we've been talking about. So she says, so does this mean if we are a crazy healthy family, that we should really just have catastrophic insurance since we're paying out of pocket anyway?
that is a way to do it. I can tell we have a fairly high deductible for our family. And I would say that we paid a lot more in most years than we've ever gotten out.
Sure. There are probably a lot of us in that boat.
We've been lucky.
Yeah.
And have not had any major accidents. And so catastrophic insurance probably works best for students and young folks that really have a very, they do get in accidents, but they typically get in accidents that aren't that terribly bad.
Yeah.
Sports accidents, twisted, ankles, knees, things like that. It does make some sense to try to get catastrophic insurance when you're young and healthy.
So, okay. Edna says, I think it was, there is a surgery tech that billed me $7,000. Why in the heck would a surgery tech bill anyone for $7,000? I asked for an itemized bill, asked to speak with a surgery tech, nothing, refused both. $7,000? A surgery tech? What is that? You're a surgeon. What's a surgery tech?
So, yeah, that's a little confusing. So there are, some people will use surgical assistants, and there are companies that provide surgical assistance to help the surgeon do the surgery. I don't know. I mean, I've seen some surgeries last a day. I mean, I don't know, but that seems very exorbitant, actually. And I do not use surgical assistants.
Okay.
So I'm not the one to comment on that. Ooh, I'm getting a leg cramp. Sorry about that.
The doctor's got a leg cramp. Stand by, everybody.
Yeah. And so, you know, I have not heard. I find that shocking. What I'd like to know is what proportion to the surgeon's fee was the surgical tech.
Yeah. Yeah, I don't have any more information here on that. It has not come up. I feel like a lot of people don't realize that you can call and dispute things that you don't think are or that are excessive.
And there's actually some state law in your favor. There is, depending on the type of provider, and they're looking at trying to change it in this legislature, that after you've met your copay and deductibles, if it's over $500, there's a mediation service through the state. And so it's usually a 3-way phone call that they will do a mediation, that they set up a time for you to call in, and they get the insurance company representative on the phone, the physician or tech or whatever this is, and they try to work out a mediation that they could pay this bill.
Is that going to cost you something to do that mediation?
No.
Okay.
It's already in effect right now. But right now it only affects certain. It's only for certain types of physicians, and they're looking to broaden it.
Okay. So tell people again the website address that you have the papers from that can help them if they're in one of these scenarios.
Yeah, it talks about the truth about surprise bill, and the website is www.texmed.org. That's TEXMED .org, O-R-G.
Okay. And the big takeaway here, if there's anything to, ideally to kind of encourage people that are either afraid of getting one of these bills or is dealing with one on the back end, what would you say? What would you say to them?
Well, I would say that you have to know your insurance product, and it is very frustrating. And if you think that the insurance company or the person that sold you the insurance company misrepresented the coverage that you have, you need to turn them in to the Texas Department of Insurance. It's TDI, and it's a 3-page form.
Do you have it there?
Yeah.
Oh, look, you brought one with him.
A complaint form.
Yeah.
And you complain. It is a complaint-driven thing. And that these insurers, some people feel, have been allowed to game the system to their advantage. And if the consumers would tell the state that they may need to look more at network adequacy. This story about, like we told you about, it's only 50-50 chance that if you go to the emergency room, the emergency room doctor that is treating you will be on your insurance plan.
Yeah.
That they need to hear that that's a problem with the patient's coverage.
Can they get to that through that website you told us? Is there access to that or a link to that?
They actually, it's in here. I don't know if there's a link. They actually there's a telephone number as well.
Okay, so there's ways that they can get to it.
Yeah, the Texas Department of Insurance complaint line is 1-800 252-3439.
All right, hang on. Read it again and read it slowly.
1-800-252-3439.
Yep. Okay. Okay. We're going to wrap this up. I know that there are a lot of people, a lot of them are comments more so than questions. And so we know, like, I think it's understood the level of frustration that's going on. Thank you, though. Thank you for coming in and talking about it. And we know this is an important issue. And I feel like we'll be hearing from you again.
All right.
All right. Thanks,
you.
guys. Thanks for joining us.
Well, it is confusing. And